this is a big deal, and I think we should all be very proud, not only here in the organization, but in the community.
I think the thing that gives me the most energy is seeing how our clinicians and providers take care of our patients every day.
So I think that it's great that here at CalvertHealth we can provide a wide range of services. It's a multidisciplinary approach to cancer care, which is what you see at even big tertiary care hospitals.
So I mean, we're all driven by passion. I think being a physician, but especially being an oncologist, you need a lot of empathy. Every single patient, I try to pause for a minute and think how I would feel in that situation.
I am most proud about our CalvertHealth Medical Oncology program because we are a phenomenal team. We work together to put the patient and their family at the center of everything we do.
Patient care is a big word, and it's a big field. I think when people come to see their physicians, they're not looking for just a scientist. They're looking for someone to actually hold their hand and tell them they're going to be all right.
It has to be acknowledged that Calvert has been, and probably will be for quite some time, a small facility in terms of numbers. But we more than make up for that in terms of quality, of intelligence, and heart.
I'm very proud of the ability to work with my colleagues. So we work as a multi-specialty group and are able to serve the community in that fashion. And I believe that's what best serves Calvert County and the surrounding counties too.
People want to get exceptional care without having to drive hours away to do it. And I think bringing in a friendship and an affiliation with Duke Health will really sort of help bolster that awareness in the community that there is excellent cancer care.
So cancer care is an area of medicine that is rapidly evolving all the time. So to be developing a relationship today with one of the top NCI designated comprehensive cancer centers in the country is incredibly exciting. This collaboration gives our entire team incredible access to really one of the nation's leading cancer institutes and the thinking of all the great minds and researchers that are constantly looking for the next best thing for cancer.
So I am thrilled about the collaboration with CalvertHealth and Duke Health. Duke Health represents the nation's gold standard in oncology care, and to have the opportunity to work with them is a tremendous benefit to our entire oncology team and our community.
So having the resources that Duke provides us is really going to be tremendous in making those doors open, both in research and in education for everyone.
Because again, we've done a lot in cancer care, but we need to do a lot more.
As a surgeon, you're only as good as your team. And having the backup of a cancer center like Duke in our backyard is unbelievably helpful to the confidence and the assurance that we can bring to the operating room when treating our patients with colon cancer.
And so to bring in an affiliation with Duke Health and the vast sea of resources that they provide, the brilliant minds that they have, to be able to receive updates regularly from them, to be able to receive training regularly from them, to be able to conference call in, ask for advice, say, hey, is there the latest paper on this specific within prostate cancer, has that been shown to be any different than what I know now? To be able to have those resources is crucial when you're dealing with something that's not just if A, then B, simple answer.
So I think the new affiliation with Duke Health will help us, from my perspective at least, as a surgeon, will help provide that multidisciplinary approach to surgery care. If there's more complex cases where I think that surgery may not be in the patient's best interest or may be in their best interest, I think a second opinion from other surgeons who work at larger hospitals such as Duke, I think it's great.
So our affiliate with Duke Health is going to take us beyond our already excellent cancer program into the future. If there's any type of complex cases, I'll be able to consult with Duke as our affiliate in the Cancer Center program to provide even further care that may not have been available originally.
There's no place like home. So especially when you're getting a very rigorous treatment for a very scary disease. So being able to sleep in your own bed, to the best of your ability, eat meals that you can prepare for yourself or that a loved one can prepare for you, just to be able to sit in your own favorite recliner in front of your own TV and not have somebody coming in all the time checking your vital signs and wanting to know whether you have produced the specimen that you're supposed to produce. Big difference, big difference.
All the advances that have happened because of trials. Hopefully we'll be able to offer our patients clinical trials so that they can do better, but they can also help the oncological world do better. It's a constantly developing field, and the key is to keep changing, keep developing, and I think that's been our biggest strength.
They have a tremendous amount of experience in helping community hospitals and developing their oncology programs. I think they have chosen our hospital because of the work we've done, and I believe that this will catapult our ability to deliver the best oncology care to our patients and our community.
The statistics will tell us that 1 out of every 3 persons will be touched by cancer in his or her lifetime. Nobody goes seeking a cancer diagnosis. If you were given the choice, you would not pick that. So, but it does come to many of us.
And so I live within the community, and it's very personal. I see all of my patients out at various events and so forth. So I care very deeply for them, like family and friends.
What I like for my patients is for us to be able to say, look, this is where you belong, this is your community, this is your community hospital, and we don't have any boundaries to your treatment. We can treat you, we can take care of you, we can hold your hands while your loved ones are right there at your bedside, and you don't have to go anywhere else. At CalvertHealth, we always dream big, and that's why we are affiliated with Duke.
The Duke Cancer Network has an incredible amount of experience working with community hospitals just like CalvertHealth to enhance and grow the services that they're able to provide in their local communities. For more than 30 years, the Duke Cancer Network has been collaborating with community hospitals like ours. I feel very confident about the future of this affiliation and what it will bring to Southern Maryland.